Dr. Ray Ramirez on our YouTube channel, helping your pets live the best life possible for as long as possible. And we've been doing a series about heartworm disease. We did a Heartworm 101, where we're kind of going through the basics of how your pet dog or cat can end up infected from heartworm by one of our mosquitoes. You may recall our infamous infected mosquito and how that ends up in the heart or in the bloodstream of our dogs and kitties and what happens. So today we're going to do more of a graduate level on the heartworm. I'm going to go into a little bit more detail so you can understand that. Maybe you're like, okay, doctor, that really didn't sound all that familiar, and have we really known that much about heartworm for that long? Well, I pulled out my Parasitology for Veterinary book. This is great night reading for those of you who are looking for a little stimulating excitement to look at. See, you have all these nice charts and graphs. But I wanted to point out, this is a book that was published in 1969, okay? And we have a whole little section on heartworm. Look at these fancy graphics. Can you see that? Have my people come up front here. See, we're a little bit more limited than people like the folks at Good Eats and Food Network and Alton Brown with his fancy little stuff here. But what we're going to look at is what the heartworm disease is. But we understood this pretty well even back in 1969. We have adult heartworms that shed what we called at that time microfilaria. It took about 10 to 11 days. Then the mosquito would pick that up, and then in about 10 to 11 days in the mosquito, they go through part of the life cycle in the mosquito, and then the mosquito can come and bite a new dog, and then it takes about 6 to 7 months to develop into the adult mosquito, and then we go on and on with our cycle. This understanding of this cycle has not changed, but we've refined this cycle so we have a little bit more detail about what goes on. And so we have some higher tech graphics to help us in this endeavor. So we have our adult worms that are in the heart. You may recall that we borrowed this heart from our dog over here, that are shedding, in our fancy medical terms, we call them larvae that are circulating, microfilaria, circulating in the bloodstream. From a clinical and what the parasitologists call it, they call that our L1 stage. So careful with the fancy graphics, hold yourself. L1 stage. Okay? My cameraman's trying not to smile and smirk. So we have our L1 stage that is in our infected dog. Okay? Then our mosquito, not this mosquito, as we already remember, this is the one that has the infective stage, but we have an unsuspecting mosquito coming, biting our infected dog. It ingests some of the L1, and then it goes through part of that life cycle, that 10 to 11 days that we saw on that 1969 book, still very accurate. And then as it does that, it's actually turning into an L2 larvae. Now careful, these names are going to get very confusing as we go along, so I want you to pay attention. We started with L1, we're going now to L2, that is in the mosquito. Okay? It takes about 10 to 11 days for that transformation to happen. Think of it, here's a good way to think of it. Think of it like a snake that's shedding its skin, and it's kind of then got a new longer snake. That's what each of these little L stages are doing. It's kind of a molt. And so think of it like it's shedding its skin. So then it's got this L2 stage, which is like this, and then we come and bite either a kitty or our other unsuspecting dog, and we inject that in there. Not we, obviously, the mosquito does, with his proboscis. Okay, that's the fancy name for the little snout that jumps in there. And then, within a very short period of time, 2 to 3 days, it turns into the L3 stage. Now, we're keeping all these names straight. We started with L1, then we're in L2 in the mosquito, okay? And then we're in L3, that's the first stage in the dog. Some of you may remember back in the days when you had to give a daily heartworm pill. This was the only stage that daily medicine was effective against. That's why you had to make sure every day that medicine was in there, or if you missed a weekend, your dog got bit on Friday, you gave the medicine earlier in the day on Friday, you'd go through the whole weekend, it would pass through that L3 stage, and then you'd start back again on Monday, and then the little heartworm would molt into L4 and wouldn't be killed by that medicine, and so you could end up with your dog having heartworm, even if you're reliable the whole year but missed a weekend vacation or trip or an extended weekend. So this L4 stage lasts anywhere from 10 to 20 days, and then we've got an L5 stage. That's our 30 to 40 day stage. Okay, and then we've got an L6 or teenager stage. Okay, now we're keeping all these names straight. I know this is very complex and we're jumping around a lot. Okay, I'll come back. Let me review. So we start with L1. Where's that from? In the dog, the infected dog, right? Then we have L2. Remember where that is? In the mosquito. Very good. Okay. L3, first stage in our newly infected dog. L4, kind of then the next stage. All these next stages are in our newly infected dog. Okay. We've got our L5, and then our L6, kind of our pre-teenage, pre-adult stage. And then we have, careful, this is a real fancy name coming up here. Anybody want to guess? Ha! L7. Isn't that cool? But that's our adult worm that lives in the heart. Diploidium caninum, anybody wants to know. Okay, all you veterinarians, don't listen to that. It was, well, the dipetalaenema was another one that had a microfilaria that looked similar, but that's another story. But it's difilaria that we have to worry about. That is the actual heartworm that's now at our L7 stage. So L1 and L2, very short-lived in the infected dog and then in the mosquito. But then the rest of these stages are all in this adult, in our newly infected dog. Takes about 6 months' time for us to go through all these different stages. And so the key thing for us dog owners and kitty owners is that these first 3 stages in our newly infected dog. This L3 stage, which is fairly susceptible to the old medicine as well as the new once-a-month preventatives that we're familiar with, as well as L4, which is also can be killed by these once-a-month medications. There's a number of them out there, and I'll go over those in a minute here. And this L5 stage as well. We can kill those with this, which is why we want to give it every 30 days so that we give our pup the heartworm medicine, and then if he was bitten by a mosquito yesterday and we're in this L3 stage, that once-a-month pill is going to kill that off. Okay? Or, let's say it was a week ago, the mosquito came, bit our little pup, and then, so we're in the L4 stage of disease, trying to keep all my stuff straight, so we're all keeping this straight, because these are a lot of fancy names. I don't want to confuse anybody. But then that once-a-month pill is going to kill that off. This is very important, and why this is helpful to note, too. That once-a-month heartworm preventative that we give protects our pets for 30 days. But what it does is it's a backwards-working medicine. In other words, this mosquito, if we give this today, the heartworm pill today, mosquito comes tomorrow, bites our little dog, he's going to have heartworm, if that's the last pill we give for a year. So, because the medicine gets in their system, it goes out of their system within about 8 to 12 hours, depending on the exact medication, and then it's not in their bloodstream at all until then the next month. So, the way I like to kind of summarize that part is that the heartworm pill works on us backwards 30 days. And the flea medicines that we're usually familiar with work forward 30 days. We're not really talking about flea, but the important part is we give the heartworm medicine, and it's working on the previous 30 days that our little pup was alive, not the next one. So if our dog's been bitten by a mosquito tomorrow or the day after, that's why it's important to give that pill once a month on a regular basis. In our area of Illinois, we're in East Peoria, Illinois. We've got the Illinois River literally just right across the Lakeview Veterinary Clinic, hence the name. It's actually the Peoria Lake that's part of the Illinois River that goes through. That river is never completely frozen. So you get a little warm spell, those little mosquitoes can hatch out. They're looking for a blood meal. We had a picture of a mosquito in January in our clinic that was killed, one in February. It's becoming a bit more common further north here in the U.S. that these mosquitoes are very common even in the winter. So that's why we like to recommend, we really need to protect our pets from this terrible disease once a month, very inexpensive to do. If we're just doing the heartworm medicine, we can get it very inexpensively and keep our pets protected from this terrible disease. Because how we have to treat them if they have our L7 or adult worm in the heart is a series of arsenic injections in the dog's body. They have to be very quiet so that those adult worms don't die off in mass and create a lot of serious problems in the heart and in the lungs. And so there's a lot of careful effort that goes in. There's blood tests and x-rays to determine that. So this is why it's just very important. So we'll talk a little bit more about prevention and treatment, which is what you hopefully don't ever have to do, on our next YouTube video. So again, this is Dr. Ray Ramirez from Lakeview Veterinary Clinic, helping your pets live the best life possible for as long as possible. And if you don't have a regular veterinarian, we'd love to see you at Lakeview. Hello, this is Dr. Ray Ramirez with our YouTube channel. Rewind.